Good morning and welcome to The Point for Tuesday, August 31st, 2021. Good morning to all our viewers and listeners across the various platforms. We're not going to stick this morning because, of course, we have shortened To The Point because of the broadcast of the CPL tournament. So we are having shortened programs on Tuesdays, Wednesdays and Thursdays to facilitate the broadcast of the CPL, the 2021 Hero CPL. So let's get into this morning's discussion. Joining me virtually this morning is the National Democratic Congress's spokesman on health, Mr. Kennedy Roberts. Good morning, Mr. Roberts, and thank you for joining us. It's been a while since we've had you on the program.
Good morning, Blossom. It's a pleasure to be here as usual and to communicate to the people at home and abroad.
Always appreciate you, sir. So let's get straight into it. Of course, we're going to start with what is on most people's minds, Grenada's evolving COVID-19 situation. Just last night, the Ministry of Health announced 104 additional COVID-19 cases, bringing our total active cases to 267 and our overall confirmed cases of COVID-19 in March 2020, 461. Your thoughts, the NDC's thoughts on how this is evolving and any suggestions that the party can make on how we can deal with this current spike in COVID-19. And of course, recording one additional death last night. Yes, sorry, go ahead.
Right. Thanks again. The NDC has been very clear from early that we would like to see a unified approach, a national approach to addressing the COVID situation. We realize now that the community spread is real, and this is the worst we've seen the situation since the pandemic has started. We want to express our condolences to the family of the lady who passed away and realize that COVID is real. We have tried to encourage that the nation take the necessary precautions. We've encouraged people to follow the basics because this is a public health problem, basically, predominantly, firstly. However, we have to take public health measures. And no matter what we do, the basic washing of hands, wearing of the mask, physical distancing, ensuring that you have a strong immune system, be aware of the science behind it, understand who are the ones who are most likely to be affected badly with COVID, try and understand the basics and let us act accordingly. Let all Grenadians be so in tune with what is happening with COVID that all of us become contact tracers. All of us become monitors of our families and our surroundings. We need to be more in tune with what are the ways in which the virus can be transmitted. And we have to acknowledge, especially now, avoid going out if you don't have to. When you do go out, wear the mask, but avoid crowded places. When you're indoors, make sure that you in tune with your surroundings. So mastering the basics, we believe, is a critical importance to the nation, and we cannot underestimate the importance of saying this over and over and over again. Secondly, we want to acknowledge that the transmission now has been really been linked to several unknown factors still, but we do know that it came into the country across our borders. And this brings us, the NDC has been very clear that especially with the Delta variant, we have recognized, and the Chief Medical Officer has made it quite clear, that it takes 3 to 5 days before the Delta variant is evident to be recognized in the PCR test. So then why are we testing persons when they enter the country on that same day? We know that is a loophole, and we know that is most likely the cause of the virus entering the country and spreading. Yes, we know that with people gathering and not dealing with the basics, it has spread. But we have to acknowledge that loophole at the port of entry needs to be addressed, and the government needs to take that approach and increase the length of, or at least the date of testing when a person arrives should be on day 3 at least. So that means the quarantine should be at least 5 days. As a result, we believe that the collaboration, the communication is important, and we want to acknowledge and thank the government for starting a series of public consultations with the various key stakeholders. The NDC has been recommending this, but we want to go a step further in formalizing it and getting a consistent interaction, consistent dialogue, and not do it when we think it's convenient. So the NDC is all for greater collaboration with the stakeholders, greater communication, and ensuring that the borders are a bit tighter. And before I pass back on to you, Blossom, the other important element that the NDC is advocating is that we are not in support of this mandatory vaccination that is being highlighted by the government or being promoted by the government. We are seeing, as we speak now, there are a lot of organizations that allow workers, both vaccinated and unvaccinated, to work in the same environment, and they're producing, they're doing their work. On the other hand, we're seeing some institutions, some organizations preventing unvaccinated persons from participating in their workforce, and they have lost a livelihood. And we have to recognize that a lot of Grenadians are going through tremendous economic, financial, mental stress, and we have to take that into consideration in all that we do. So we have to recognize that if the NDC was in office and did not have this mandatory vaccination approach that this government is advocating or promoting, then a lot of people would not be going through this stress, because COVID is dividing people. This vaccination, mandatory vaccine, is dividing our country. We're seeing just about 20% of the population being vaccinated. It means that 80% have a hesitancy. Rather than divide us and bully us and coerce and do all sorts of trickery to get people to be vaccinated, let us have dialogue. Let us show a balanced approach, because COVID is it's a novel coronavirus. So there are a lot of things we do not know. The resistance to the vaccine is based on people's genuine concern. So while the government is saying one thing, remember we have access to limited information on the internet. And while not everything we see needs to be believed, when we see other countries taking certain actions, we have to ask ourselves, why are we pursuing a mandatory vaccination program when there are other approaches that can be addressed? The debate is out there with regards to the use of hydrochloroquine and ivermectin as prevention methods, as a method of treatment. We are seeing the debate going back and forth, but more and more as the research evolves, we're seeing that a lot of countries are acknowledging the benefits of ivermectin and hydrochloroquine in the treatment of persons with COVID. I'm hearing that in the Grenada context, we're saying that it should not be used, but we have to be open to different approaches as this thing evolves. So the NDC wants to again indicate its clear position that we would not support a mandatory vaccination campaign, because apart from the fact that your individual rights and responsibility and all these historical issues about vaccination and making people do things with their body against their will, the records are out there. So we need to strike a more balanced approach and ensure that this issue does not divide our country more than we're divided already.
I always have to ask the efforts that the party is making to get in touch with the health officials to collaborate. You spoke of having a collaborative approach to dealing with COVID-19 and other issues, of course, but I always have to ask, what approach has the NDC made, or effort has the NDC made to reach out to, whether it's the Minister, the Prime Minister, other health officials, CMO, PS?
You see, I am the spokesperson on health for the NDC. And I have reached out, I have spoken to people, and I've been told clearly that they don't want me. I don't know if it's at a personal level or they don't want the NDC represented on their coordinating body. So I am not going to push myself where the government is in charge, and they have the responsibility, they have the authority. They're the ones who have to guide the process. They are the ones who have to lead the process. However, the NDC, we're meeting with various stakeholders, and as we discussed, we met with the trade union recently, with the chamber, and so on. And as we discuss various issues, the issue of COVID is undoubtedly one of the things that we're discussing. We have done public service announcements. We have met with people in the community. I've been talking on various programs. Other colleagues have been talking about it. And there's so much we can do. But we continue to advocate for people to have a choice. Now we're seeing the AstraZeneca is supplemented by the Pfizer. And a lot of people have gone forth to take the Pfizer. Our political leader, Brother Adrian Persuada Thomas, he went and he got his shot in the last week or so. And as a result, a lot of people are going forward. So we have to continue encouraging people to take the vaccine. I've been vaccinated from May. And I continue to tell people it was my personal choice. And we need to make decisions based on our reality. So we need to be clear and educate the population on who are the ones most at risk. Because we're seeing now all these cases of COVID. How many are actually hospitalized? Yes, we have the one death. And again, people are acknowledging that when you have a lot of other comorbidities, when you have other health problems, when you're diabetic, hypertensive, high cholesterol, you might be obese, and when you have a lot of underlying health conditions, you're at higher risk. So we need to communicate this information and encourage because we have a high level of diabetes and hypertension in the country. Let our public health clinics in the community talk to our communities on a one-on-one at the health center and have that personalized encouragement and promotion. So while it is good to have ads on the radio and the TV, put up a billboard and so on, I think we need to go to the level of our health community, our health practitioners, being in touch with our community and really encourage people to understand the importance of the vaccine, because it is quite clear that the vaccine, while it does not prevent you from getting COVID, it reduces your risk significantly. So the issue that we're really talking about in COVID now is risk reduction. How can we minimize the risk of getting COVID and dying? The vaccine contributes to reducing your risk of hospitalization and dying, but also there are other things that reduces your risk of getting it. So wearing your mask, sanitizing and washing your hands regularly, minimizing your time in crowded spaces and so on, the physical distancing. We have to focus on this. We have to encourage people to strengthen their immune system. We have to make sure that there's good social cohesion, meaning you can talk to your family and your friends, because the mental health aspect of this disease is really affecting a lot of us in a manner that sometimes we don't recognize. So we have to realize that we need to support each other in many ways. The curfew makes you come in at an earlier time. A lot of households are not as cohesive as others, and the internal stresses at the family level, we need to take that in consideration. We have to start preparing if things get out of control and there's a need for a national lockdown. We have to think of those vulnerable households who do not have the means to have food for a week. A lot of households are eating food on a day-to-day basis as they can barely meet their basic needs. So we have a lot of work to do in terms of preparing us for what is ahead of us, which is uncertainty. We have to encourage people to be planting more food. We have to ensure that we can be self-sustaining in our nutrition and eat well and build up our immune system. We have to be talking about these things as much as we're talking about getting vaccinated. So while vaccination deals with it, especially at the end stage to prevent you from getting very ill and hospitalized and dying, at the early stage, we have to improve our immune system. We have to exercise. We have to communicate in a manner where we feel mentally strong. So there's a lot of different approaches that needs to be done. And the NDC believes that holistic approach that is needed, that strengthening of our health system to make sure our health workers are capable and willing to work with our communities, those elements are still lacking in our health system.
Speaking of elements, how can we add other elements into this conversation as we try to get the economy to bounce back and try to at least return to as close to normal as possible? I know you are an avid farmer. How can we tie in agriculture in this conversation, especially with the economy the way it is now?
Right. Now, in the last couple of months, I've shifted my profession. My relationship with St. George's University came to a 23-year end, and I'm focusing on a little entrepreneurial project linking agriculture and tourism. And in my experience so far, we have to improve the link with the Ministry of Agriculture. My extension officer, for example, she's very willing, and I try to keep in touch, but it is difficult to get that support from the Ministry of Agriculture in terms of helping me to go to the next level. So, for example, I would appreciate a little farm labor support. We have to let that farm labor support get through the community and really help people based on actual need, help people to go to the next level. So while I might be in a position to get a 1 or 2 days help a week, I'm not able to do it at the level I want to at this stage for various reasons. But there are a lot of other small farmers who need that little support to go to the next level. But we also need to encourage households to have a fig tree. If once you have a little spot outside, have a lime tree, have some of the basics that can sustain us over time. Because planting your ground provision, having a callaloo drain, we have to encourage those basic things throughout our communities and link that agriculture with our health. So in terms of how we prepare nutritious, attractive meals to get our kids to eat more of the fruits and vegetables that a lot of them don't like. So there must be a concerted effort to link agriculture with health, with education, with our social system, and really have an approach based on people's wellness, people's development. And when we appreciate the importance of working together in a collaborative way, and let our public sector, our ministries of health, they're supposed to be guiding and leading, so our public sector is not as motivated as they could be. So the NDC is advocating a greater intersectoral linkage between health, education, agriculture, nutrition, and have a more balanced approach to human development in a consistent way, as a policy measure, and not just as a hit and miss approach.
Mr. Roberts, let's take a quick break and then we're going to come back and continue the discussion. We're speaking with the NDC spokesman for health, Mr. Kennedy Roberts. On to the point this morning. We'll be right back.
As GBN brings you coverage of this year's Hero CPL, there will be some adjustments to our programming lineup. On match days, transitions will be aired from 5:25 p.m. and GBN TV News will be aired from 6 p.m. and repeated following the CPL game. GBN, with you anywhere and everywhere with sports coverage. You're not here to give it all than what you're here for. So get up.
There's no better way to start your day than with me on Good Morning Grenada. Good Morning Grenada is your one-stop shop. We have information, education, entertainment, your bi-weekly traffic cam, and we link up with the sister isles of Carriacou and PT Martinique. Join me every 6:35 on weekdays for Good Morning Grenada. It's your daily dose of all things Grenadian, mixed with just a little bit of crazy. Good morning, good morning. I said just a little bit of crazy.
I tell all of the things that take me.
Good Morning Grenada, 6:35 a.m. on weekdays, available on all GBN platforms. Start your morning off right.
Feel good tax.
Remember, if you have flu symptoms, do the right thing and stay at home to avoid giving it to others. Remember, you can be infectious up to a week after developing symptoms, so rest up and take it easy.
Welcome back to the Point, speaking with NDC spokesman on health, Mr. Kennedy Roberts. Before we go to our callers and listeners, Mr. Roberts, let me ask, there has been, not even recently, but the conversation and the talk and the discussions about the state of Grenada's healthcare, even specifically at the General Hospital, that it leaves much to be desired. And the talks have resurfaced following the death recorded yesterday, the COVID-19 related death recorded yesterday. Any conversation that the NDC can join to help us better our healthcare system?
Blossom, this has been my lifelong work in terms of health systems, management, health policy. And for decades, the whole thrust to strengthen your health system. Health is not about medicine alone. Health is about wellness. Health is about your environment. Health is about your water quality. Health is about exercise. Health is about your housing condition. So there are a lot of things that really contributes to your health status that is outside of the health system per se. Now, there's a lot of information out there, the Pan American Health Organization, the World Health Organization. There are a lot of agencies out there who do research, who document and give best practices and so on. And there's a major report of a few years ago that talks about leadership in health and what is important to really get our health system working in the interest of people. Because health is about people first before it is about money. So while we know it is expensive and all these good things, we know that it is primarily about people. So the NDC have been advocating for years. And even when I was involved with the other party, I advocated for years that we need to focus on some of the basic things. The conditions of our health workers, for example. Our health workers is a critical component of making your health system work. And if our nurses are unhappy and they're leaving the system, if we're bringing people into the system who doesn't have that experience, it is going to affect us. Our information system, how our medical records, how do we use that data to guide us? We're seeing diabetes and hypertension and so continuously increasing every year. What strategies are we really using to address that and curb it? When we look at our medical supplies and so on, again, Grenada spends a lot of millions of dollars every year on medication and supplies, but it is managed in a way that is not optimal. We can do a lot better in terms of managing our medical supplies. And of course, don't talk about how we pay for healthcare, health financing. These things are critical, but one of the most critical is governance and leadership. And the country has lacked really strong, knowledgeable leadership in health for too long. And this has contributed to a lackadaisical approach to our health system, and the linkages are not there. For example, we have the St. George's University on the island, boasting of one of the best medical schools in the world, producing the most doctors for the American market. but some of the basic things that needs to be done is not done in collaboration with them for us to have the best health system in the region and in the world also. When the NDC was in office in 2008 to 2013, we were very close to getting that teaching hospital in place. I was at SGU at the time, and I remember us having meetings with the World Bank and the government, and the Chancellor made a big presentation, and we were moving in that direction. Once 2013 came and NNP came back in office, that project has not really gone anywhere. So we have to look at the ways in which this government has approached our health system, recognize that while health is a difficult issue in all countries, there are certain basic things that we have been talking about over the years that can help us improve that is not being done. And I am convinced that the only way that we can really move forward and strengthen our health system for the future is by getting this government out of office and giving the NDC the opportunity to really work with all the stakeholders in a genuine manner that does not have that partisan twist to it, and really make Grenada's health system one that we can be proud of for the long haul.
All right, let's get to some questions from our viewers and listeners. Somebody on Facebook is inquiring, what is the NDC's position on a total lockdown? And can you tell us if NDC, with the second largest voters involved in organizing community centers, churches where the vaccine can be administered? And lastly, we were told to do the protocols and eat fresh colored fruits and vegetables. Taking of vitamins, including zinc, when did this went off the table and the pushing of the vaccine became more forceful on the people than the way we should eat as we did in the last 18 months? So first, what is the NDC's position on the lockdown? Secondly, what is the NDC doing to encourage vaccine being administered in the communities? And thirdly, why are we pushing the vaccine and not encouraging people to eat properly?
Okay, I will take the last one first, because this opportunity we have, not just in Grenada, but throughout the region and the world, to get health education to be more prominent. We have to use this opportunity where people are thinking of COVID to talk about the other health issues. And as I agree with the question, why aren't we promoting the other elements as strongly? And we have to, and this is why the NDC does not support the mandatory vaccination approach, because we believe that you need to have a balanced educational approach. We're seeing research come out that talks about other approaches to minimizing your risk. Let us talk about that. Let us promote more the basic, the hand washing and the sanitizing and the wearing of the mask and social distancing and so on. We have to make it continuous. But we also have to talk about your immune system. We also have to talk about mental health. We have to talk about how are we coping in these difficult times. We're seeing suicides, attempted suicides, stressful situations affecting us. How can we really help in doing that? It has to start with all of us as individuals being aware of those around us. Those around us in our families, in our communities, in our workplaces. We have to be more in tune and how we can deal with them. Now, the whole issue of advocating for vaccines all over the country is one element of it. But if people are not going to take the vaccine, I think we have to deal with the hesitancy problem. Why are people hesitant? And one of the main reasons I believe, and we've discussed that, is that the lack of trust in the government. When people don't trust you, they cannot really take what you say and just go with it. When the government is not telling us where they got money to pay Grenada, when they're telling us things that we know is not authentic, when they're promoting oil and gas and we're not seeing anything about it, the people have lost trust in this government to the point that it is difficult to think. So it's not about going to health centers and churches and doing the vaccine, but it's educating people so that wherever you set up on your daily basis, people will feel encouraged to do it. And in terms of the lockdown, we have to ask what would be the benefits of the lockdown. the lockdown is not going to be effective if people do not deal with the basics. If you do not wear your mask, if you do not monitor your environment, if you do not wash your hands and do your social distancing and so on, no matter how much you lock down, it would not really have that effect as much. So I think we have to monitor closely. We have to encourage people to do the basics. But in terms of the lockdown, the NDC believes that we should continue to monitor what is going on very closely. And that determination should be based on the evidence. And we have to focus heavily now on encouraging people to take the basic precautions. And I repeat it again, wear your mask anytime and wash your hands and social distance. And don't go out if you don't have to. And when you go out, and of course, strengthen your immune system as much as possible.
Let's go to the landline. Good morning, caller.
Morning, Blossom. Morning to your esteemed guests and also the viewers and listeners. I'm a little bit encouraged at what Mr. Roberts is talking about, because these are some of the things I've been seeing over the months and over the year now. It's an unfortunate point that we haven't seen the need as a people to have a collective approach, not a party approach as the government wants to do, the ruling party wants to, where everybody could contribute. My organization, Friends of the Earth, so it's necessary and put in to bring a doctor, an eminent doctor from the state, Dr. Velva Bose, to help us to understand the phenomenon. GBN was invited. They did only a partial coverage of it. We had her last week again, 2 weeks ago. We even sent an invitation to people like you, Mr. Robert. It wasn't responded to. Now we have in the next one about people's rights, the right for people to decide and so be able to do, to choose with Dr. John Cheron Benjamin of Trinidad and Tobago. And we hope that you can be there. But certainly the main point I want to say is that the need for a community or collaborative approach. I've been seeing problems that people are dying on their own. We need to work as a nation together. Everyone who has something to contribute should be allowed to contribute. And you don't have to wait on government. As Friends of the Earth have been demonstrating, there's a need, there's still a need. And so I'm encouraged what he's saying. We need to work together because this thing is going to be with us for a long time. We need to know how to deal with it. And food security is the main part.
Thank you very much. Thank you very much. Minister Roberts? Minister.
You see the final point he made, that this thing could be around for a long time and we don't know. So that is why we have to take a balanced approach. And that is again why we have to try and unify our nation rather than divide us a bit more. So that approach to education and information and getting our health workers at the community level to interact with our communities. How functional are our health centers and medical stations now? How confident are people to go there and get information? We're talking about the schools being delayed, they're opening again. How are we using technology? The NDC had started a program and had talked about it when they were in office. The whole area of technology in our schools should have been at a much higher level now so that we should not be delaying the starting of school. I heard Mr. Bartholomew this morning on another program, the president of the Teachers Union, talking about the fact that, they performed incredibly well under difficult circumstances last year. So why shouldn't they be starting school now using the technology? So there are a lot of things that need to be done in terms of the consultation, rather than decisions just being made in what appears to be a very ad hoc manner. That shows the need for that continuous collaboration, working together, team approach, national approach, and see this issue as one that all of us should be involved in.
WhatsApp question. Somebody says, Mr. Roberts, would you recommend that the vaccine be administered at all medical facilities on a routine basis as other medicines, rather than only at health centers and at these pop-up clinic distances away?
Again, I think there are a lot of locations that the vaccines are available. And that's not the issue. The issue is, are people going to get vaccinated? So yes, you can set up things in all the health centers and so on. However, we need to educate the public as to the importance of taking the vaccine and give people the information. So for example, we're hearing now that the efficacy, the strength of the vaccine is waning after 5 to 6 months, and you might be needing a booster and a booster and a booster. You know, a lot of people are saying, you know, why is that necessary? Why can't we function and take the necessary precautions without having to get that vaccination? And as things evolve, there might be other approaches to treating COVID than the vaccination. So I want us to use caution in our approach to this whole COVID situation, but the basic public health measures cannot be overstated, and we need to be aware of our personal surroundings or family or communities, and we need to be contact tracers. We need to communicate with people. If you feel that you're exposed, you know, you should stay indoors, make the necessary calls, get the follow-up, but do not try to go out there and if you believe that you might be exposed. So we have to be our own contact tracers to a great extent, monitor what is happening, and really try to follow the basic precautionary measures. And that is going to do a lot more than a lockdown or even a curfew.
Good morning, caller.
Morning. Blossom, you know what? I suggested in view of the fact that we have so lots and lots of cases, what I would suggest, you see, you have to get a handle of this situation. One, in terms of the borders, you have to have them more than 2 days for quarantine, maybe 7 to 8 to 10 days. Then all the people that have now, what they should do probably, bring them in one place. Because I remember when I was growing up, and probably Kennedy would know too, you had this leper settlement in the south of the island that you call, that's how the name quarantine. All the people that they could identify that have the virus right now, through the contract case or whatever, take everybody and put everybody in one area. You don't leave people to self-isolate home and all this kind of thing. Put them in one area and feed them. Get somebody to do a contract and feed them 3 times a day, disposable box and so on and whatnot. And also, you have to take into consideration their families, because some of them might have their breadwinners. So you are working people. So you have to have these people also. It will cost a lot, but they have to spend the money. And also, you have to be able to feed them and feed their families. Because when I hear the man talking about the people who are sick and they're going out to work, they don't have no other choice. They would love not to go to work, but who is to provide for them? So they have to be able in a position to provide for them, and that is how the thing is spreading. So I'm calling on the government to take the necessary resources. It's going to cost a lot, but you see, the most important people in the world today is your people, the human being, the human resource. Put all of them in one area, the stadium or whatever big place it is, monitor them, have some effective guards so that they wouldn't be able to jump out, feed them properly, and their families too. That's the only way we might be able to get this thing under control. But when they're going out in the buses and so on, they had to get the food to feed their families. So
thank you very much, caller. Mr. Roberts?
Yeah. And again, that is a good point that he's making, that there needs to be, and we're 2 years into COVID, we should have looked at a quarantine facility so that when we have positive cases, we do not send them home without the treatment being completed. We also have to acknowledge that while some institutions saying, yes, you need to be vaccinated to come on the job, the SGU, for example, people are able to contract and spread the disease even though you're vaccinated. What is happening down at SGU now? You've seen the students walking around without wearing their masks. They're interacting as if nothing is happening, and we have to realize that this is increasing the risk, because when workers leave SGU and go to their home, they're interacting with people who are not necessarily vaccinated. So we are seeing a situation where we have to just encourage people to take the public health precautions and advocate strongly for tightening up our borders, The testing on arrival should not continue. The testing should be done at least 3 days into arrival here, and let that quarantine period be acknowledged. Because in most countries of the world, the world is accustomed to a longer quarantine. What is the rationale? What is the real reason for the government having it at such a short period? Yes, people benefit because the data will show that most people do not have the virus. But in the case where you miss it, like I believe that's the situation now, we're seeing the impact. So I believe that the duration of quarantine is something that should be really considered.
As we prepare to wind down the shortened program, Mr. Roberts, any final thoughts that you'd like to share? What's next for the NDC as Grenada goes through COVID-19, or any other plans that the party has going forward?
Well, the party has been looking at its policies and programs, and of course, health is central to the whole vision for the NDC. We see health not just as the absence of disease, but when you have a strong physical, mental, emotional well-being, when the society is functioning in a way that people are happy, people are prosperous, people are comfortable. We want to see the wellness and health component of our Grenadian life be given a lot more attention. So we are asking people to, in this period to appreciate the difficulties we're going through. Those who are affected personally with COVID, be strong, strengthen your immune system. You can make it, you can defeat it. We know those who are out there, they must move around, take the precautions, wear your mask, physical distancing as much as possible, wash your hands and sanitize, and deal with the basics. So we encourage everybody to let's fight this together, because we can all live and function in whatever circumstances, but we need to do it in a united way. And finally, Blossom, tomorrow is a special day for Grenada. You know what tomorrow is?
Kirani James say?
Kirani Day. Exactly. So I think the whole of Grenada need to recognize the role Kirani has played in boosting all our immune system. Kirani generates a joy in our heart that not many things do that. So we want to wish Kirani a very special birthday tomorrow. Let him, God continue to bless him with health and strength to do much more for Grenada. And we ask the country to pray for him and continue to guide him as he moves forward with his career.
Thank you very much. Appreciate that. Appreciate you, Mr. Roberts. Thank you very much for being our guest this morning. Continue to stay safe and continue to stay healthy. Good luck in your farming journey.
Thank you.
Have a good one. NDC spokesman on health, Mr. Kennedy Roberts, we thank him for being our guest this morning, and thank you, viewers and listeners, for tuning in to The Point. Like I said at the beginning of the program, on Tuesdays, Wednesdays and Thursdays, we will have shortened To The Point programs as we broadcast matches of the 2021 Hero CPL. The game this morning will see defending champions Trinbago Knight Riders coming up against St. Lucia Kings. The Kings features Grenada's Andre Fletcher on the team. So let's see what happens in that game. Enjoy the rest of your Tuesday. I'll be back tomorrow morning, God willing. Have yourselves a lovely day. Continue to stay safe. COVID-19 protocols are in full effect. Have yourselves a good one.